Hello again. Good morning, good afternoon, and good evening to all our members and colleagues joining from across the region in the Middle East, Asia, and Asia Pacific. I'm still Jeannie Wong, Head of Communications and Events for ACI Asia Pacific based in Hong Kong. Welcome back for this fourth session of at ACI APEC Online. Last week, I really appreciated the conversation between Martin Moody with our colleagues from Qatar Duty Free, Hong Kong International Airport, and Melbourne and Launceston airports. Now, as frequent flyers in the industry, we always look forward to an efficient, seamless journey and stress-free travel experience. But for many of us, we've not been able to travel at all due to the plethora of travel restrictions. And for those who have traveled, it certainly has not been stress-free. Today, we're privileged to have our world business partner, SITA, lead in a conversation on delivering confidence to fly again. Representing SITA and moderating the conversation is Paul Cross. Paul is the Project Portfolio Director for SITA Border Management. Paul, may I pass the time to you to introduce our guests and start the conversation?
All right, well, thank you. And thank you to everyone for joining us for what I think is a really important discussion for our industry at this point in time. And as you know, the theme of the discussion is delivering confidence to fly again. And I'm very happy to say that we have some genuine experts in this area to help us with this important discussions. And these are people who've been working on strategies to restart the travel industry from a number of different perspectives. But I should start with some introductions. First of all, my name's Paul Cross. I'll be moderating the session. I'm the head of the Sydney border practice for SITA. I'm also very involved in the biometrics industry. I'm a director on the board of the Biometrics Institute, and I lead their future directions group. So I'm very interested in future directions for our industry. I work for SITA, as I've said, and for those of you who don't know about SITA, SITA is a leading provider of services and expertise across the air transport industry. We've been around for 70 years. We had our birthday last year. And we work with just about every process in the industry, from passengers to baggage to various aspects of operations and all kinds of business dimensions there. And with over 2,800 organisations in our industry, covering airports, airlines, baggage handlers, and including governments and border agencies. And I think they'll be important for our discussion. And because we are 100% owned by the industry, we have a particular focus on making travel easier, bringing stakeholders together in a more connected environment, and making travel smarter and more efficient for passengers. Panelists for today, starting with Albert Lim, who is the Senior Vice President of Airport Operations Management with Changi Airport Group. Albert oversees the passenger terminal operations, quality service management, and integrated facilities management at the Singapore Changi Airport. And in his previous role, Albert was Vice President of Cargo and Logistics Development, responsible for the air cargo and logistics business at Changi Airport. And his division managed a global clientele of air express integrators, cargo airlines, third-party logistics companies, and international freight forwarders. So he's got a wealth of experience in our industry in this field. And next, we have Abdullah Al Gerasi, who is the Emergency Management Coordinator for the Directorate General of Civil Aviation at Kuwait International Airport. He's currently in his 10th year of service. And Abdullah heads the Airport Emergency Health Committee, and this is the topic we'll be talking about in regards to health and travel. He is also a member of the International Health Regulations Committee with the WHO, the WHO. So I think we have some excellent speakers, and to join them, we also have from SITA, Andy Smith. And Andy is our global lead for government and industry engagement with the SITA Border Management organisation. And since 2012, Andy has represented SITA's government, security and border management business. And in addition to promoting the effective use of passenger data, pre-clearance, risk assessment, border management and biometric solutions, Andy champions the collaboration of all stakeholders in the transport industry with a focus especially on the passenger experience. I'm going to ask our panelists about restarting travel. And I'll start, if I may, with yourself, Albert. Obviously, there are many people and many industries around the world waiting for international travel to restart. And it's a kind of frustrating and a kind of confusing time for us. How do you see, Albert, the travel industry opening up again?
Thank you, Paul. Thanks for having me with you for this program. No, I think the last 1 year has been an extraordinary year for the global aviation industry. I think, in fact, all of us are looking very anxiously, monitoring the various developments across the different countries and see how we can really restart stronger and the travel recovery again. The way we look at it, I think the restarting of the travel won't be a big bang approach. I think many of us are expecting a more phased approach, where I think for the countries developing some relationship and some agreements with different countries that probably have reached a certain level of infection control or a certain status of vaccination. And then each country would have a bit of, say, air travel bubble. So some of the things that we are seeing that different countries are looking at, I think this is probably something that we can expect to in this year as we do a phased approach. I think something that the aviation industry and the airport, we are working very closely with our airlines and the various government agencies in trying to make this happen.
No, so it's an incremental approach, and you've talked to us about the way that governments will need to come up with agreements. I might ask yourself, Abdullah, what else do we need? What do you think that the industry, including regulators, need to provide us to begin our roadmap to recovery?
Okay, hello everyone. The main thing right now, and it's a big topic for all of the countries, is the new passport. Basically, they want a passport for people that have been vaccinated to travel freely. I think until we get that established between all of the countries of the world, that will basically be the first step to us reopening everything, especially like all the airlines, all the connections. It will solve a lot of issues. Also, with all of the new technologies right now, the applications of this, it will solve so many issues just to be coordinated and to have a communication database shared between all the countries. It is kind of hard because of the different vaccines that are going around. I know some countries are only approving their own vaccines. Others are approving all of the vaccines. I think it's something that's going to take a little bit of time to get solved, basically. Plans have been put into place to get the wheels rolling on this. And I think within I hope it will happen this year, to be honest.
Okay, thanks. So we've heard that governments need to reach agreements to start travel, and we'll get to a deeper discussion about health passes, for example, and people are looking at them and wondering what direction we get from regulators and from the industry. But Andy, can I ask you, are there things that organisations within the industry can be doing right now as these discussions continue?
Yeah, thanks, Paul. And it's great to hear from Albert and Abdullah as well. And there's definitely an alignment. I think the first thing to point out is that the industry has already done so much in this space. The collaboration that we're seeing and previously competitive partners working together to really come together to restart the industry. I've never known our industry to be so collaborative, and it's great to see. As you mentioned in the opening, CETA was established on collaboration, on the need for airports to communicate and airlines to communicate. 25 years ago, governments came into that conversation as well. And I've been really heartened by how we've come together as an industry to try out new technologies, to adapt to what has been such a horrific experience for all. And it's interesting to see how industry is now adopting to these new paradigms. As Abdullah mentioned, the rise in vaccinations. I think we've got to live in a world now where we can take this additional health data that is going to be a requirement of travel for probably years to come, and how do we get that information shared? So I think we've made a good start in collaboration. I think we need to continue that, and we need to deepen it. Bubbles are great, but we need those bubbles to start connecting together. Mm-hmm. So prove the technology, prove the process, and start to operate at scale rather than prove an individual technology. Let's prove that we can operate our industry collectively and well together with confidence for all.
Okay, thanks. So thanks, Andy. So Abdullah mentioned health passes. Let's discuss health passes a little bit more. Abdullah, I guess there are a number of different health pass solutions out there right now in the market, and they offer ways for people to digitally verify that someone has met particular health requirements. But for you and from your perspective in your business, what would you say are the important characteristics of a good health pass solution?
Okay, so what I think is basically interconnectivity between different agencies around the world. We have been using barcodes recently to check, to make sure that it's an authentic PCR test, basically, for people that are getting tested before coming into the country. This took time to be approved, and you get basically the red flags once in a while. But there is a solution for everything. Extra testing right now is the second precaution that we're doing in Kuwait International Airport. So basically you have the first test, and then you have before you fly, and when you arrive, you get another test, and then you're quarantined for 14 days. We use an application called the Shlonik for people entering Kuwait to monitor them, basically to make sure that they're staying home. And if they have any health issues, they send everything through this application, which is also a benefit to this. I think with more advancements, basically it's an agreement between countries and governments to make just one system, universal system to all of the airports, and I think that will make it work. But as I said before, it's agreeing on what vaccines are approved in some countries and others. That's the main issue that we're having right now. I think it's a simple solution. It can be fixed very easily. It's just people agreeing together.
Mm-hmm. As Andy said before, the stakeholders coming together. And Albert, you mentioned that governments would have a very important role in shaping the directions for us. What is it specifically that governments can do to help us manage the health information that we're talking about?
Of course, first of all, I think it's important that from a global basis, some of these digital health passports or standards. I mean, ideally, we would like to have a harmonized standard so that just like the way the passports are MRZ codes, all these things, that all different countries will be able to read them. But I think it may take some time to reach there. But at this point of time, if there will be some recognition of standards, recognition of the passes or is inoperable, means that some readers or some verifier that could actually verify your standard, and then I can trust it, some mutual recognition of some of how you have actually did your digital certs. I thought that would be a good first step, short of having that Eureka or the Nirvana of having a harmonized standard. But if there are some form of that mutual recognition between bubbles or between connection of bubbles, I thought that would be very helpful, good first step that can catalyze this opening. Of course, from Singapore's government's experience, they have also worked very closely on digitizing this health information that make it mandating the clinics to be able to send digital certs into the database where the passengers will be able to retrieve for their travel. So government does play some roles in mandating how some of these health passes or test results or vaccination status can be digitized so that the country would be able to use it as they travel. So I thought these are some of the things that government does play a role in catalyzing some of that the digitizing effort, instead of just relying purely on the airlines to do that, which I think if all parties are doing their part, the catalyst effect will be there.
No, that's a good point. So Albert, we've talked about the fact that there is technology to assist with this challenge, and we've talked about the fact that the vaccinations are coming and the PCR tests are there, but we're missing some things, and you mentioned that we are missing some standards. Are there other things we are missing at this point in time? There's a race for people to go out there and get vaccinated, and we know that one day we will be relying on people proving that they've been vaccinated with some kind of digital capability. But is there anything else about this process that is perhaps missing and something that governments can assist with?
Well, I think from a global airports point of view, of course, we from aviation sector, you serve passengers from different countries, and different countries may in a different state of readiness in terms of being able to produce a digital certificate. No, so I think from a government point of view, I think it's also important to be inclusive, especially when we want to open up the borders travel. I think digital is a very important medium to be able to facilitate that in a big way, but there must also be ways that governments should also look at how we can recognize a hard copy, at least for the start. While this may require government to have mutual recognition of how they will present the digital, the health cert in the different way, so that there's a bit of that authentication process that we can recognize the health cert from this country. If it's a digital version, I think it's all good, but there must also be efforts that the government can really look at mutual recognition of some of these health certificates between the traveling countries. If not, I'm just afraid that in terms of the opening up, you need to, if you don't need to wait for some countries to be able to digitize their portion, then that could be some delay in a way how we can guide this industry along. But certainly I agree that it's the way to go, but there's a phased approach that we really need to work very closely together, the different stakeholders.
So can I just come in on the commenting on some of the things that Albert mentioned there as well, and I totally agree. I think some of the challenges we have, particularly with the standards conversation, if you think it took, 20 years to get standards on e-passports. Now, I know the industry is moving quicker. Regulators are always going to be behind the industry, behind technology. So we need to help the regulators. I think both Abdullah and Albert mentioned the need for trust, and that's absolutely critical. We need to trust the process and trust the results from other countries, as you mentioned, Albert. Unfortunately, governments don't tend to trust the results that are outside of their control. And I don't quite have the answer yet of how do we ensure that happens. And I know WTTC, the Good Health Pass Collaborative, are all working on ways to engender this trust and this confidence. Vaccination information, yes, the world is getting vaccinated. Abdullah mentioned this, the need for the vaccination information. I think he's fairly optimistic about it all being this year. Some estimates say it could be up to 5 years before the world is vaccinated to a level that, and we have to support the sort of less developed nations in their vaccination programs. But we also need to help governments realize that we need to operate at a level of acceptable risk. We do this in our industry pre-COVID. We trust documents issued by others, even though there are, 60 million fraudulent passports in circulation. We don't shut down borders because there is a risk of somebody traveling on a fraudulent or a lost and stolen passport. At the moment, governments with the COVID risk are basically having a zero appetite. They are shutting borders, they are shutting down our industry to protect their citizens. But at some point, we need to get to a level of acceptable risk in order to operate with. We know there are going to be fraudulent vaccination certificates. We know there are going to be fraudulent tests. They're in circulation now. As industry technology providers, we need to work with the stakeholders to minimize that risk, recognizing that you will never have zero risk in this industry. And that's where the collaboration, the sharing of information, getting, in Sweden we call it a health hub, a health gateway of information that stakeholders can trust, but make decisions on that trusted data source. And that's what we need to convince governments and travelers that it's an acceptable level of risk that we can move forward on. But Abdullah, you mentioned the process in Kuwait as well. What's really killing our industry at the moment from a travel and tourism point of view is quarantine requirements. People aren't going to go on holiday for 2 weeks if they have to have 2 weeks in quarantine when they get back, paying
after
for hotels.
Trip,
yeah. And how do we do that? How do we convince governments that with testing, with vaccination information, quarantine isn't required? Is a huge challenge for us all.
Okay, thanks, Andy. So we can trust the technology, we can trust that vaccinations work and that PCR tests work, but we need governments to help us be able to trust the process and the fact that the tests or the digital certificates have not been granted fraudulently to the wrong person or accidentally to the wrong person. And that's something else that governments can assist with. Can I move on to some of the other challenges that we'll be facing as we start to restart travel? And Albert, I might ask you. So there's a lot of promotion around the fact that these health passes can be a driving force to restarting the industry. But to what extent do we just rely on those only? There will be a different speed of vaccination program per country. How do we deal with that?
For maybe learning from the experience of the Singapore government, I think there's also a risk mitigation or risk classification effort. I mean, if you're coming from a region of certain countries that have pretty well control the infection pretty well. I mean, in terms of the number of cases infected, I think for some of these travels, you could actually relax that requirement. For example, as like what Andy mentioned, quarantine is the one that going to kill all sorts of travel. You really travel, you're going to kill leisure travel, you're going to kill the business travel if you have quarantine. The only people that really travel because of quarantine, because of family and friends segment. They really want to meet their family and friends because they have been apart for many months, and they are willing to do that in order to meet their family and friends. So in a way, the different segment of passengers, even in the travel recovery, would also be affected. So hence, in that regard, I think in terms of if we have a bit of a risk classification, which I think many countries are now doing, and then maybe we can couple it with a test, either pre-departure test or on-arrival test at the airport. And then once you're cleared and you come from a country that's relatively well managed this pandemic situation, then we will allow you to be able to do your business in terms of business or traveling or leisure. So I thought that would be another lens to look at in terms of what government can do beyond all the digital health cert, etc., where you also have a bit of that background of how the different countries that coming to you're going to connect with are doing, and then we give them a bit of differentiation of that treatment. So I thought then slowly this create the building blocks, in a larger scale opening. Like what I mentioned, it probably won't be a big bang opening and then business as usual back to pre-COVID style travel. I don't think it will happen, right? But I think it's about putting in policies, putting in processes, risk mitigating measures, testing that can actually open up those low-hanging fruits, while then we wait out some of the other countries to get their infection in control, and then the government have the willingness to open up that travel lane again. I thought this is how I look at it. Then looking from the experience of how Singapore is managing this situation.
No, thank you. So in the near term, it's not just a technology solution, government policy, conscious of the challenges in the industry and really to the challenges to economies everywhere are going to continue to be for the next few years really important part of the equation. Abdullah, back to the subject of health passes. And I know there's been some terrific results already with providing confidence through the use of these capabilities. But are there risks associated with being an early adopter of these solutions?
Of course. With anything new, there is a lot of risks. We were discussing this other day, just a group of us from different industries. Basically, a recommendation was put between us. It's a good idea. I think if governments decided to use it, I think it would do good for everyone and just solve this issues. Basically, so people are getting vaccines right now. These vaccines are common capsules. So if you put on each capsule a recognized barcode, that can be submitted to a universal app that countries can use. So if a person got his 2 vaccines, he's free to travel. This should be submitted to an app. He can print a document or just leave it on his phone as a barcode. He can show it to any airport border and then just roam freely. Some countries want to do extra tests. I mean, I can do an extra test. I don't mind. If I'm vaccinated, I'll be glad just to keep peace of mind and be sure that I'm not affecting anyone. I'll be free to roam, which is also a good recommendation for people that are trying to avoid the vaccines, as I'm sure a lot of us see right now. So if I put this on a barcode and people are seeing it, that you can travel freely, you're also pushing people to get vaccinated and to see how the procedures are much easier traveling again. So I think it's a start to reopening. But in regards to just all the technology and is it hard or easy? It's everything is hard about Corona, to be honest. With COVID and all of this, I'm sure we were all shocked with the big changes that happened in the industry. I never expected ever, with all of my years of experience, to see the airport closed and me walking around in the field with no aircraft movement. So it's a shock. It is a good experience for all of us. I'm sure a lot of us learned everything, and as a colleague said, the communication between agencies has got so much better right now because people are free to share their thoughts. There's no borders right now in discussing all of the solutions. Everybody will listen to you. Everybody's ideas put into play, which is a good thing. Most of the ideas that we put for infectious disease before COVID happened, we never expected to use them, but we were also prepared for all this. So when we put all of the information and the data that we had into play and just see it work, it was wonderful, to be honest. I know it's not something to say with COVID-19, but it was wonderful to see how things work smoothly. And for the first time, I think all around the world, different agencies are working together that this thing has never happened. Okay, for us here in Kuwait, we worked with every agency, to be honest, from airlines to basically foreign affairs. You know, it's so wide. All the work, all of the time that has put into everything, just to make the procedures and basically regulations for people to fly and come back, and just even the shipment. You got into so much details. It's a big improvement. I think we will improve more with time. I hope nothing happens like COVID again, but I'm sure after this lesson, we're all prepared for anything to come.
Great points. So you're right, there's just never been as much focus or energy or collaboration for our industry, and people have been so busy with growing volumes, but now we've had a chance to focus on different things for a little while. Andy, so health passes are obviously going to be key in the future, but the industry relies a great deal on its ICT capabilities and its information flows. So does this health pass solution, do these solutions just operate in isolation, or do they need to integrate with other systems? What else do we need to get things moving?
Great point. And you're absolutely right. I think when we first started trialing some of these health passes, it was done very much in order to prove the technology. And as mentioned, apps were presented, QR codes were scanned, but it was a very manual process. And I know at airports, I'm sure Changi have faced this as well, airports were having to fully staff for 10-15% of the traffic volumes in order to accommodate these additional checks. That's not sustainable going forward. So, and again, this was mentioned by my colleagues on the panel, we need to have interoperable systems, but not just from a technology point of view. As you mentioned, they need to be interoperable with existing process. So as I mentioned earlier, we already carry out many checks. If we can incorporate the health pass information into those checks, so it's more strangely familiar, it's more trusted by the stakeholders, that when we check a boarding pass, we're checking the right that somebody has to board an aircraft, they're in the right terminal, it hasn't been used before, that immigration checks have been done, and that the health status has been checked as well. So if that could all be incorporated, then we can reuse existing infrastructure. The airports have spent millions on contactless and seamless journey programs, originally to accommodate what was expected to be a doubling of passenger numbers. Now, obviously, that's not the case anymore, but we can reuse that technology to do low-touch or zero-touch checks through the airport. It'll see an increase in the adoption of biometrics as well. And I think a lot of the schemes are allowing biometrics to be captured and shared by the travellers as well. So we can see an increase. That's something that came out of the IT Trends survey that CETA conducts every year. I think 2/3 of airports were saying that they're going to invest in biometric and self-service technologies for things like boarding. A lot of information around that. So I think the pass schemes have a vital role, particularly in terms of providing that interface between labs and travellers, connecting an identity, bind the identity to the test results, and then it needs to plug into, be interoperable with existing airline and airport processes for it to be adopted. We are always going to have a bit of an intervention, particularly while there's still testing. It's intrusive, it has to be, it's a procedure. But the more we can do to share that information so that we minimize the numbers of tests, and you're not having both a departure and an arrivals test. And as I say, colleagues have done 5 or 6 tests for one journey. There's a huge cost associated with that as well. Again, prohibiting travel and transportation and tourism. If the cost is too high, it's higher than the ticket price that airlines are getting in terms of testing, how are we going to regenerate the industry? So, as we've all said, test once, share the information, And as we move away from testing towards vaccination, then we shouldn't need to test as much. Abdullah is absolutely right. Vaccines are about protecting yourself from serious disease and serious impact of COVID, but they don't necessarily, and I think the testing is still being carried out, they don't necessarily reduce your capability to infect others. So we need to sort of get this balance, and I think we'll see that shift over the next year, 2 years between testing and vaccination, but they're going to coexist for some time to come.
What I would like to start talking about now, and picking up your point, and Abdullah, your point as well, is life beyond COVID. And Abdullah, you made the point that there's a lot of energy and a lot of focus and a lot of collaboration on this particular problem at this particular point in time. What else should we be thinking about beyond COVID? These health pass solutions, for example, do they just go away?
Okay, so we can always use these health pass, basically, not just for airlines. We can use it for many things. I mean, even if we make it, I can put my full registry of what I've been vaccinated in into that system. So I can use it in, not just airports, even just some universities require you to show what you got vaccinated before entering the university. So basically, I can use this health passport to show even for work, for a job application, for many different things. So it's a multi-solution that I think will save us papers, basically, because you can keep it in an application on your phone. And if you ever want to show anyone, you can just show them a barcode or your information and all of the vaccines that you've taken. I think this is a simple solution, and it will stay with us basically from now on. It's just how we as individuals use it, how governments use it, how we implement it. I mean, okay, we're talking about airlines, but if even here, like if you travel from country to country between borders, you're still using the health pass. If you're traveling by sea, you're using the health pass. Basically, you can show your health pass at a hospital. So I think it's a multi-use thing that will still be there in the future if we use it wisely, of course. We can benefit from many things that happened during COVID, especially all the applications, the information that's being spread around, the coordination that's happening between all these countries. If we keep using these things, it will keep us all closer and safer as a community and the world, basically. I also recommend like the meetings that we're having right now, all these discussions. It's to benefit everyone. It's not just something that we're going to keep for us. Basically, we're doing this to inform people, to inform staff that are working. I have general meetings almost every day just to get the latest update. And some of the staff are basically putting their information that they got vaccinated and everything. So it's happening. It's a good thing. It's not bad. I recommend people get vaccinated. I just hope that we solve this issue very, very soon. Basically, the health passport and people traveling. Because as we passed just now, we were discussing this. If I'm traveling outside abroad Kuwait, I have to get tested before I leave. And then when I arrive, I have to get tested depending on the country's regulation. And then coming back, I have to do the same thing. And then I'm using an app to put all of my information because when I get back, I'm still going to be quarantined. Okay, so all of this is expensive and it's taking your time. I already traveled, let's say if I'm traveling for a week and I'm coming back, getting basically quarantined for 14 days, that just kills me. And for a lot of people, it doesn't make sense, but it's not our choice to make. It's what basically people in higher places see that's safer for the greater good. I saw a picture recently online that said, oh, well, people are basically waiting in line after each other. They have a distance of 2 meters. And then once they get their passport stamps and everything, they're sitting next to each other in the aircraft. I mean, it does the kind of, it's funny and not funny in both ways, because in the end, we are sitting next to each other. I mean, we can't split passengers on an aircraft. I know airlines are getting hit hard by COVID and all of the regulations that are happening. But as everyone has been saying in the past, basically taking your own precaution, wearing your mask, keeping yourself safe, sanitized, everything. I mean, simple thing. I keep this in my office. As you see, no one's in my office, but basically it's there. If someone opens the door, I just have to protect myself. If everyone is self-aware and takes care of themselves and their family, we're all safe. But we know that some people are reckless, some people don't care, some people don't care about others' feelings. We understand that, but we do these, basically, if I look at it, governments are doing these extra procedures because of these people. Some of you might be taking extra precautions, some just don't care. They walk around without masks, they don't care. And it's kind of sad. It's kind of sad because basically all of this makes it hard for all of us. And if we get into one line, all of us put our hands together, it will work. We will move on toward the future. And we have all these procedures put into place to help all of us and make things simpler. I do want to travel, to be honest. I would like to travel right now. But well, being my place, I can't really travel right now. I've been in work since the beginning of COVID. We had basically our early warning monitoring system with WHO. So everybody saw how COVID started and everything. Everybody got the warnings, everybody got the information. It was a shock. I remember the first days of COVID. I never expected to be in my country, to be honest. And with the notion that we actually closed the airport. And basically, I don't know, so some of you might not know, we had a big evacuation for all of the citizens of Kuwait from all the countries around the world. We almost brought, it was about 70,000+ people back home. And these people are infected countries, so we had to monitor them. We have, basically the government put different places, just hotels, resorts, fully booked just to quarantine people and just to keep them safe. It was big, yeah, project, yeah. And nobody was seeing that coming, to be honest. Yes, we did have our precautions, but you don't know what the disease is in the beginning. Nobody knew that COVID would affect people so bad, but it happened. And then just general discussion, if you sit with doctors and people basically in the field, it's kind of sad to hear the stories of people just, all these people that got affected.
True global crisis of the kind that I certainly have never seen before, and our industry hasn't had to experience. No. But can we go back to what happens after COVID? And
COVID.
Importantly to me, we've had, and I might ask Albert this, we've had this absolute upheaval in the industry, but as we've said, we've also had this enormous energy and focus and innovation, major innovation. Mm-hmm. What, Albert, can you tell me what you think the major lessons that we have learned are from COVID that will be important in the future?
I think this is what we have seen, I think around the world, the increased accelerated pace of digitizing some of the key processes. Like, and for example, I think there are a lot more awareness of how we can use technology. I mean, even the current platform of Zoom and Teams and work from home, it was virtually unthink of, right? In a sense, before the COVID. I mean, but I think many companies, including the aviation sector, has also paid a lot more attention of how we can step up on the digitization effort. And because our customers are also now more savvy and more comfortable in using digital, and is there a way that we can engage them in a different way now? I mean, in a post-COVID world, I thought this is one area that I think many people are looking at. I mean, in terms of airlines point of view, airports point of view. Second, higher awareness is about the importance of biosafety and cleanliness. right? The hygiene, and I think, of course, airport is a big place, right? I mean, there's a lot of people passing through every day. How are we looking at some of these common touch surfaces? Can you use contactless, for example, for the kiosk, or is there even immigration, some of the thumbprint or iris? Is there any way that can process passenger without really touching the surfaces, being contactless? I thought this is what this is our own experience in airport. Our immigration authority has used to use the thumbprint, but I think as part of this COVID, I mean, they started to use iris as the dominant biometrics to process passengers. So actually, a passenger, when you already have your biometric captured in your passport, and actually you depart, instead of verifying through the thumbprint, you can use biometrics. So these are some of the things that I thought is encouraging, because this COVID has actually brought forward the digitizing effort of what many companies want to do, but have a bit of more resistance or inertia until COVID hits them, and then they realize that they have to accelerate it. So I thought that would be one of the positive outcome. And of course, for all awareness of the safe distancing, if you're not feeling well, please wear a mask. When you're out there, I thought these are very good behavioral change that would actually benefit the industry as well.
Well, that's wonderful, and I think you're right. There are some positives here, and when we talk about what the industry will look like in 5 years or 10 years, but I'm just going to ask one more question. I'm going to ask all of our panelists to give me their thoughts on this in about 60 seconds, very quickly. Let's talk about 25 years and beyond, a horizon of 25 years' time. What's your vision for how the industry will work, recognizing that there's a sense of opportunity around us right now to be positioning for something that is truly transformational? I'll start with yourself, Albert. Thanks.
Well, 25 years time, I hope that I'm enjoying life, no longer managing the airport, and I can travel around the world. So this also means that I think we believe that the lure of travel, the wanderlust, that the people really want to connect, want to have experiences, because of travel bring experiences, want to connect with family and friends or even business associates. I think that one will continue. I mean, of course, COVID have a bit of hiccup, but I think we will emerge stronger, and the industry will continue to grow. And in that regard, I thought that some of this more awareness of the importance of personal responsibility during travel, as well as a digitization effort, where as an individual passengers, as I mentioned, I can do all my processes. I can enable my journey through my travel, from a check-in, from even dropping a bag. Do I really need to have an agent to drop a bag? I can do an automated bag drop, right? Without interacting with someone. I can already clear immigration with e-gates, right? And of course, from a security point of view, of course, I mean, who knows, 25 years time, with all the X-ray, all the CCTV, as you walk by, they can really look at what you're carrying, and you don't even need to be served by someone. So I think the vision of 25 years time, which I believe is not unthinkable, you can really enable and empower your own travel journey through all the way through the airport process. And this is one of the vision that we want at Changi Airport, where you really empower your own travel experience. Through I thought that would be awesome.
That sounds good to me, Albert. How about yourself, Abdullah, from your perspective and from your role? What's your vision? What's your ideal future for the process of international travel?
I think it will be better. I don't think we will. In 25 years, I'll probably be retired. But I don't think it's going to be the same, to be honest. I don't think that what we're seeing right now is basically, we are a lot advanced right now, but in 25 years, things are going to be completely different. I don't think people will have to interact with people going to the airport. Okay, everything will be on screens. You'll be monitored basically, and we can stop you at any time. I think that's where it will happen. So the interaction is going to be less between people. So if we have everything basically digital, which is the heading that I'm seeing right now. Everything is becoming digital. Face recognition, the eye print, your handprint, everything. I mean, even the passport, you probably don't even need a passport in a couple of years. You probably use your application on the phone. I think we're going towards that way, basically. Even in our country, I mean, like your own personal ID now is on an application. So you don't really need to show it. You just show them your barcode, they scan it, and they get all of your information and make sure that it's the correct you, basically. So in the future, I think we're going to go towards that. Of course, airlines will be better, different planes, or maybe we're not going to use planes. It depends, yes. Maybe we can go into space, you never know.
There you go. But I think I'm going to challenge Andy on this. Andy, these are great visions. How are you going to make it work for us? Because I know you'll be working in 25 years' time because you love it.
I'm shocked Abdullah's going to retire in 25 years. You look far too young to retire in that time frame. But yeah, I mean, at the moment, the challenge is we don't know what the world's like in 25 days. It's moving so fast. I agree with everything that's been said. First of all, health information is here to stay. Identity is here to stay. In 25 years, Abdullah just mentioned this as well. The checks will all be unobtrusive. So you won't have bits of plastic. I don't think we'll have e-gates. I don't think we'll have that demarcation between airside and landside. It will just be that seamless process led by biometrics. I think the adoption of biometrics is inevitable, and we need to be aware of the sort of the sensitivity around that. But it's happening. It's happening everywhere, and those checks will be done based on worldwide sharing of information, of secure nets working together, but trusting the information from one network to another, and enabling, as I walk through the airport, my verification is done unobtrusively. I can drop my bag anywhere. Robots will take it away and process it accordingly. And when I arrive, I will just walk through. And as security checks will be done, it will just be unobtrusive, and will transform the airports into experience centres. And I know, Changi is a destination for people in Singapore. They go there not to travel, but to experience the airport. It's the same in Mumbai. We want airports to be a destination in themselves. We want them to be an experience rather than a chore. And at the moment, too many airports are painful, and they're more painful at the moment because you have to go 5 hours before in order to have your COVID test and sit and wait around with a lot of idiots, as Abdullah mentioned, these people who don't respect social distancing. I think we will always be a social species, and Zoom is a useful tool, but it doesn't replace a handshake. It doesn't replace seeing somebody. And I hope in 25 years, we still want to be social creatures, and we still want to meet, greet, and travel and stand in queues.
Well, look, thank you. I think we went more than a minute each, but it was fun. So I enjoyed it. So, but what we might do is bring it back down to earth. And Andy, since you're talking, can you tell us about the kinds of things that that our organisation's been doing to start facilitating this new world, this new experience, and managing those health risks?
Yeah, absolutely. It's what we've been talking about on this panel. Is we run the existing processes for airlines, airports, governments. We do that now. We do it in partnership with airports and with airlines and governments, and we are encouraging that partnership and that collaboration to include health data into the existing processes. We've all had to learn a new language. None of us knew what PCR was a year ago, I'm sure, or LAMP tests, or antigens, or antibodies. We now know this language, and it's got to speak and be translated from the language of health into the language of travel. And that's certainly what CETA is helping to enable, with partnerships, with relationships, with new bodies and new technologies to plug it into the existing process and make adoption easier. With a translator between the new requirements, the old 12 months ago, the old world of the passenger processing capabilities and the sharing of information between all of us. And that's what CETA is enabling to do, working with partners like Changi in Kuwait. That's what we do.
All right, thank you. Thank you, everyone. I think that brings us to the end of the panel session. It's been a terrific discussion, exactly what I'd hoped for. Absolutely recognise what a difficult and challenging time it has been for all of us. But I think it's encouraging to know that there are solutions, technology solutions that help us. And there are processes in place already that make it much safer to travel with good controls at either end. We've acknowledged the important role that governments play with these processes and with setting the policy directions in a very fast changing environment where there might be no risk today, there might be risk tomorrow, and that policy settings need to adapt quickly for that world. But I think also, and importantly for me, it's just been an incredible time to innovate and to set directions to manage this particular risk, but to be able to use those capabilities for the transformation that we have imagined for many years, and to start creating that vision that we all want for easy travel, getting to see this wonderful world and meet each other very easily in the future. So look, thank you to all of our panelists. Thank you to everyone who has joined us, and there will be more interesting sessions coming as part of this series. Thank you, and bye for now.
Thank you.
Thank you, gentlemen. We certainly appreciate the candid conversation and insights you have brought into this. As usual, we want to thank our sponsors and supporters, including CETA, for making this event possible. We want to thank you, our audience, for tuning in and engaging with us. Let's keep the conversation going. Now, we've had some very fruitful and meaty conversations these past 4 weeks. Next week, we will take a pause. Join us again the week after, same time, same place, on Tuesday, 1st of June, for the second half of ATI APEC Online. Now, if you sync the event to your calendars, don't worry. You will get a prompt and be reminded, assuming you haven't turned off your devices or computers. If you have any questions in between, please do feel free to reach out to us via email, Twitter, or LinkedIn.
See you in 2 weeks.